Hi, everyone. My name is Hanny Al-Samkari. I'm a classical hematologist and clinical investigator at Massachusetts General Hospital in Boston, as well as an associate professor of medicine at Harvard Medical School. I also have the pleasure of co-directing the Mass General's Hereditary Hemorrhagic Telangiectasia, or HHT, Center of Excellence, where I care for many patients with HHT. HHT is the second most common inherited bleeding disorder, about twice as common as hemophilia. And patients with HHT have bleeding from a number of different locations due to abnormal blood vessels that form either inside the body or on various bodily surfaces. The most common manifestation in terms of HHT bleeding is nosebleeds, recurrent heavy nosebleeds that can be really problematic. But patients also have internal bleeding that can be really serious and potentially fatal. So patients with HHT not uncommonly develop gastrointestinal bleeding, and that happens in the intestines and the stomach from the abnormal blood vessels that form along those surfaces inside the body. That bleeding very frequently leads to iron deficiency and iron deficiency anemia, along with the nose bleeding. And iron deficiency and iron deficiency anemia are really problematic. They are debilitating for many patients with HHT. In fact, anemia, iron deficiency anemia in particular, is one of the top 5 causes for hours of disability worldwide. It's crazy how much this impacts people. And it really impacts people with HHT. The fatigue, the lack of exercise tolerance, the need for additional sleep. It's really, really troubling, and patients continue to bleed unless they go on effective therapies, which are hard to come by in HHT. And so this is something that really impacts the quality of life for patients with HHT. In addition to the iron deficiency and iron deficiency anemia that we get from the gastrointestinal bleeding, really all the kinds of bleeding with HHT, it creates a need for intravenous iron infusions in coming into the hospital to get IV iron, creates a need for blood transfusions for some patients just to stay alive. And these patients are living at very low blood counts that would be almost, unthinkable for most people without HHT to live at that low blood count. And finally, there's a new kind of bleeding in HHT, or it's not new, but it's really newly recognized, which is heavy menstrual bleeding in HHT, which a recent study showed that 3/4 of women with HHT complain of heavy menstrual bleeding. And this is something that, is often missed in the clinic, and something that doctors, all of us, need to do a much better job at picking up on and adequately treating in patients with HHT. So, in addition to the nosebleeds, patients with HHT have to deal with gastrointestinal bleeding, heavy menstrual bleeding, and all of the iron deficiency and iron deficiency anemia-related problems that come along with that. For more information on HHT and everything HHT related, visit curehht.org.